right now, we have interim committees meeting in the legislature. They don't take, they're not passing legislation. They're basically study committees. But they are in preparation for the legislative session that starts next January. You can come down here, for instance, and look at the Children and Families Health and Human Services Committee. You can see the people who are on that committee. You can see their study topics. You can look at the underlying legislation that authorizes them to do that work. They're doing an awful lot of work in behavioral health right now. The point of this is this website is really critical as you get ready to engage. As you get ready to engage the legislature, you will find not only who represents you, what they're doing, and again, you'll be able to create what's called a preference list. I'm just wondering if anybody out there who hasn't created a preference list before, tried to create one over the past week, and if you had any success on that, if you wanted to share that, or if you have any questions about the website or ways to find out about your legislature. Quiet group today.
Matt, this is Brenda. Will you be also going over how nice it is to use that website to communicate with legislators? There's a messaging function that I found to be extremely helpful.
That's a good point. So let's go to, how did we do that again, Brenda? It's been over a year. How do we do that again, Brenda? I forget. I'm rusty.
If you want to share your screen, we can navigate together.
Oh, you're not seeing the screen. Yeah, they must have taken it off. That must be why we're not seeing it, because it is really easy.
Yeah.
What you can do, to Brenda's point, during the session, you can go in and you can find your legislator, and it will create basically a form, and you put your name in there, you put your contact information in there, you put the legislator that you want to contact. You identify the bill number that you want to talk to them about, and then there's a text box. And the text box you can enter in, and what you can do is create a Word document with your input for if you want to talk to more than one legislator. You can figure out what you want to say. You can write that in a Word document. There's a word limit, so don't send them 20 pages. That's not going to be effective anyway. And then you can say you're for or against that bill, or you can say that you're I think it says you can say that you're informational if you're neutral, and then you can hit that right from there, and that will go. And my understanding is what happens then is those get printed out and get laid directly on the legislator's desk. And there's a lot of them. They get a lot of them, but it is a fairly efficient way to communicate with legislators, and it's a fairly efficient way to get others to communicate. Sometimes that you get, I would say that's a good way to do it if you want them to hear your voice. It's not so great if you want them to really, if you have a relationship with somebody and you really, for instance, you know somebody really well, you want them to make sure they're hearing from you. You want to make sure that you're making that connection. You know, if you have a cell phone number, if you have a direct email address, if you can pick up the phone and make a call, that is more effective. But the website does allow that option. And if it's a legislator you don't know from a part of the district that you don't know, maybe they're on a committee that is critical, but they're from the other side of the state, but you want them to know that people care about this. I use it all the time. And public health officials use it all the time. I think it's not on here right now because the legislature is not in session right now. Are there any other questions or comments? Really would advise you to bookmark the legislature's website and really become, and as you go through the legislative session, what I think Lisa's going to talk to you about later is how we work through our public health associations to work together in this. You don't have to remember all this right now. You don't have to do this all by yourself. That's the point of the associations. So, but if you can bring some of those tools to the table when you engage with those public health associations, it can be really helpful. Any other questions? Okay. All right, we're going to try this again. So, can you see that? Do you see the executive, legislative, judicial? Is that right?
Yep,
This is what we talked about last time, just as a review and to set the table for today. Montana's system of government operates in much the same principles as our federal system. The three branches of government. The executive is the governor. The legislative branch is the legislature, formed by the House and the Senate. And then the judicial branch that has the ability to be a check on both the executive and the legislative branch. Together, the executive, the legislative, and the check and judicial create state law. Those state laws are called, we often call those the MCAs or the code, Montana Code, state law. They pass, if those get passed, they usually get passed by the legislature and approved by the governor. Sometimes the governor can veto and the legislature can override that veto. But generally you get state law and it flows into what's called the Montana Code annotated. That then passes authority down to local government and state agencies, and in some cases other organizations, to do the work of government. So remember we talked about last time, our local governments really derive their authority and their power, their duties from state law. We're not, it really is important to understand that, and to as you work through and engage with policymakers at the state and local level, that authority that is granted through by the Constitution to the legislative and the executive branch, the check of the judicial branch, that authority really flows downward, and is critical to understanding your place in government as public health agencies. Local government then can using that authority pass ordinances, regulations, rules, policies, septic rules, for instance, the variance rules for septic. That all flows out of state law that's approved by the legislature, and in some cases managed by state agencies, which then put out something called administrative rules. We call those the ARMs or the regs. And that mixture of those state laws and those ARMs really are what tells us what we can and can't do as public health officials, and the people that we report to, our boards of health, our county commissions. So public health, this is from last time as well, really fits within we're a partner. We are part of the system of governance of the state of Montana, and we not only are impacted and impact ourselves, the governor, the legislature, and the courts, those three branches of governments, but also state agencies. County attorneys are part of the Montana Code, says that county attorneys are the legal counsel for boards of health and health officers. County and city commissions are critically important, as we've learned up close and personal since the 2021 legislative session, when the way that authority is shared between city and county commissions and boards of health was altered by the legislature, and many of your counties are still right now working through the process of figuring out those changes. The point of this, though, that I wanted to make is we're a part of state government, we're a part of our local government, we're a part of the system. We're not separate from it. We're not outside looking in. As public health professionals, we need to be and view ourselves as partners in this overall organization, and we need to be good partners, and we should be able to expect those other agencies to be good partners to us. Again, in Montana, the Montana code, I can't stress this enough. Continue to go back to Title 50 of the Montana Code, 50-2-116. Those powers and duties of the local board of health, those powers and duties of the local health officers, those really need to be the foundational documents that tell you what you're supposed to do and tell you what authority you have to do it. So make sure you go back to that, and make sure not to be afraid to remind the others around you, not in an obnoxious way, not in a finger pointing way, but say, look, I've got this job to do. We have this job to do under 52-116 and 52-118. That's the foundation from which you should be engaging policymakers, I think. Some rules to live by as we go through this. We talked about this last time. My number one, if you come away from these classes with anything, relationships are essential. Develop them early, attend to them regularly. It is too late to develop a relationship with a legislator. I shouldn't say too late. It is not optimal to develop a relationship with a legislature once the session is in place and they're casting votes. You really need to develop those relationships with the individuals who represent you, because they're your partners. They should be reaching out, and they should be people. We all work for the people of the state of Montana. We should be working together. Be available to policymakers when they need you, not just when you need them. And that's where I say those initial conversations that I would recommend you start having right now with your local legislators. Ask them what they need from you, and offer your services during the session. If they want to call you and talk about legislation or ideas that they have, just be available to them, and don't just have it be a two-way street, that relationship. Most decisions happen well before a vote or a public meeting. So engage early. Not all of them, but if you start engaging when they're casting a floor vote, or the day before they're casting a floor vote or a committee vote, you're probably a little bit too late to have the maximum impact. You really want to engage them early. Listen. Probably the one thing that I would say about our society today is people aren't very good listeners. They want to be heard, but they don't take the time to hear what others are saying. And so really allowing people to be heard, acknowledging what they're saying, not just waiting for them to stop talking, but really listening and responding. And when possible, provide options and alternatives. Don't just be against something, provide a solution. Don't just say, hey, that's a bad idea, don't do that. Say, hey, that's a bad idea, don't do that. But here's this other way that this other county did this. That's a really good imaginative way to do this. Maybe we could think about doing it that way. That gives them an alternative. It gives them another path. You want to create another path for them, and not just throw up barriers to the work that they have to do. The last thing I would say is don't forget you represent more than yourself. You speak for your organization, your community. If you're working in a capacity as a health officer or a lead health official or a public health, if you're working, and so just be cognizant of that, be connected to that. Anything you say and do, your actions, you should be okay with that being published in the local newspaper. You should be okay with having this conversation at your local diner or with your board of health. Whatever the case may be. That idea of making sure that you are connected to your community and you are understanding of what the expectations are of the people that you report to, whether that's the Board of Health or county commissioners or whoever that may be, making sure that you have that you have that agency and you have that so you have support from them is really important. I'm going to get into this. I'm going to talk about lobbying rules. rules in Montana. When you engage with the legislature, you will often hear people say that they've registered as a lobbyist. That requires some money, it requires, you know, some bureaucracy. In most cases, from most public health officials, in the way that they're doing this, I'm going to show you, you probably don't have to worry about registering as a lobbyist unless you're doing this a lot and you're really spending a lot of your paid time doing it. But we're going to walk through that. I don't want to overemphasize this. This should not be a barrier to you engaging in your government, but it should be something that you're cognizant of. So as we go through this, I want to engage in it that way. Don't worry about this too much, but just be cognizant of it. And there's some things that you can do to make sure you understand it and be and stay within the rules. So this is I think NACCHO put this out, and they really try to create a separation between educating, informing, and then advocacy and lobbying. And you can read that for yourselves. But they really try to create clear definitions of what lobbying is, what advocacy is, and what nonpartisan education is. I'll give you a minute to read that. I'm not going to read it to you because I don't think anybody needs that right now. So this is another way that they have helped you visualize this: meeting with a member of Congress to educate them on the Zika virus and how local health departments are actively involved in preventing and responding to Zika outbreaks. Now that's educating them. Really, advocacy is more like, hey, we really need funding to deal with this Zika virus. And lobbying is meeting with a specific member of Congress to urge them to vote for a bill to provide emergency funding. I would say, and so in putting these slides together, I did consult with an attorney that the Public Health Institute has hired to really look at this. And his advice was, if you get into trying to define whether or not you're educating versus advocating versus lobbying, that may be very difficult. It may lead to problems. You can be a judge of that yourself. If you go have breakfast with a legislator to introduce yourself, especially if it's not during a legislative session, I don't think anybody would define that as lobbying. That's just making yourself available. But if you're calling them and saying, hey, vote against HB 123, that's absolutely lobbying. So why does this all matter? In Montana, we have something called the Montana Lobbyist Disclosure Act, which defines lobbying as the practice. Brenda, you want to read that for me?
Sure. The practice of promoting or opposing the introduction or enactment of legislation before the legislature or legislators, and the practice of promoting or opposing official action of any legislator or legislature.
So that's pretty specific, right? I mean, that's how you define lobbying. That's how the Montana Lobbyist Disclosure Act defines lobbying. There's exceptions to that. It's not considered lobbying, and there's nothing wrong with lobbying. There are just, if you do it, there are thresholds above which you have to register as a lobbyist and be transparent about, hey, I'm a lobbyist. I'm lobbying on behalf of the Gallatin City County Board of Health. I never did that as a health officer. I never got to the point, and I'll tell you why in a minute. There's exceptions if you're an elected local official acting in the official government capacity. If you're an individual acting just on your own, you're a free citizen. If you're just, if you're a Montanan and you're responding as a Montanan, you're not a lobbyist. You're just doing it on your own. You're not representing anybody. You're not representing your board. You're not representing your department. You're not being paid to do that work. And then if the information or testimony, if the legislature requests that you provide that, if they ask you your opinion, that's not considered lobbying. The other exemption is the monetary exemption. This is the one that really will help you understand you probably don't have to register as a lobbyist. It allows an exemption from disclosure and registration if you receive less than $2,650 for lobbying. And that the Commissioner on Political Practices advised that all compensation received for an individual for time spent lobbying should be counted toward the 2650 threshold. So what does that mean? So if I'm health officer and I'm paid on an hourly or weekly basis for my time, there's a fairly easy calculation to find out what your time is worth per hour. So for instance, Public Health Director John Snow is paid $21 an hour for his work as a lead public health official. If Director Snow plans on lobbying the legislature, at what point must he register as a lobbyist? Well, he gets paid 21 bucks an hour, but you really need to count in the fringe benefits. That's generally about 30% of Director Snow's wage. So say it's about $6.30 an hour. So his time is really worth about $27.30 an hour. And you can all do this calculation. You all know what you make an hour. You can add in the fringe benefits generally just by adding about 30%. That's a pretty good rule of thumb. Remember, the threshold for registering as a lobbyist is $2,650. So if you divide that $2,650 by the $27.30, you've got about 97 hours of time before John Snow hits his threshold for registering as a lobbyist. That's a pretty significant amount of time, especially if you factor in that not every interaction that you have with the legislature, you are going to qualify, you're going to classify as lobbying. If you have breakfast with the legislature, I wouldn't call that lobbying if you're just trying to introduce yourself and make sure that you know that you're there as a partner. That's really a personal decision that you need to make about how strict you want to be about what you classify as lobbying and not. One thing that you might want to do if you're worried about this is just create a log of the times of the hours of effort that you spend lobbying over the course of a year. This is just totally made up, but on April 1st, you write a letter about HB 222. Down here, you're calling legislators, and you're adding up those hours of effort. You're getting to that. I think the most valuable piece of this, I've never heard of anybody in public health being asked for anything like this. Have you, Brenda? No. I mean, this does not come up hardly ever. However, if you want to make sure that you're on the right side of those laws, the simple thing is just to create an Excel sheet, keep track of the times when you do lobby. And if anybody ever did question it, you could say, hey, look, I'm under I'm under this 2650 threshold. I track it. I'm pretty careful about it. And that's why I'm not registering as a lobbyist. If you are over that time as a lobbyist, over that amount of time, you are probably spending a significant amount of time, and you probably should think about registering as a lobbyist. But for the vast majority of you, even health officers like Brenda, who are asked to go to the legislature all the time, it's going to be it's a substantial amount of time that you'd be spending, over 90 hours. That's well over 2 weeks of your work year. You'd be, actively asking them to approve or disapprove of a particular piece of legislation.
And if I go up to the Capitol, Matt, and sit in a hearing room for 2 hours before I get a chance to actually stand at the podium, I don't count that time. I only count the time that I use to prepare and then to actually stand at the podium and speak my comments.
Actually, if you've got one of these and you're doing other work while you're sitting there waiting, absolutely. The point of this is not to scare you away from engaging with your government. The point of this is just to make sure you know the rules. And by knowing the rules, you can very easily respond to people and say, hey, I get this, I get that, but I don't register as a lobbyist because I don't spend enough time doing this. Rules to guide your work. The one thing I would say is you want to have a conversation with your board chair, with your board of health, or your county commissioners, if you can, say, hey, I want you to know that I apologize. I want you to know that I need to be engaging with the legislature. I want to make sure you're okay with that. I'm going to do my best to represent us, but here are some things that I think are really important that they hear from us about. Even better is if you can get it written into your job description, if you can have a policy from the board that says that's part of your job. In that in Montana Code annotated 50-2-118 for health officers, it says that part of your job must work collaboratively with other parts of the government to fulfill public health duties. I would just say, I think it's good. I think it's important. And I think it helps you to make sure that whoever you're working for is aware that you're doing it and is somewhat supportive of the fact that you're doing it. But I think you can present that. There's differences in the way you present that. You can say, hey, the legislature deals with stuff sometimes. I get calls. I want to be able to engage in the legislature. That's different than casting yourself as this lobbyist who's going to be in Helena for half the session and is going to be camping out. And to explain to them what you're doing, don't let that be a barrier, but make sure that they are aware of it, make sure that they're supportive, and make sure that as you engage with policymakers, you're doing so in a way that reflects well on you and the people who are behind you back at home. If you do plan to lobby, like I said, track your paid time spent lobbying in a way that allows you to document adherence with the Lobbying Disclosure Act, and conduct your work engaging legislators in a way that reflects well on your organization. We already talked about that. Again, I can't stress enough. I hesitated to even include this piece in the class because I think it gets overdone sometimes. I think it's fairly simple to document your time and just say, hey, I'm not registering as a lobbyist, but it is something that might come up. It's something that I've wondered about. We decided to go ask a lawyer to give us some guidance. And what he came back with is track your time, stay under that 2650 threshold. And if you go over it, register as a lobbyist. Even if you don't go over it, make sure you're having at least a conversation and hopefully some sort of written documentation that, yeah, it's part of your job to work with policymakers to support the department. Any questions? Just somebody in the chat mentions that employers usually provide some sort of guidance about engaging policymakers and lobbying.
Matt, I'll just jump in and add a little bit of experience as a department director. I tend to be the one that will go up and testify. Some of our division administrators, we have 3, they're kind of experts in specific areas. They may as well, but we're really careful with other staff in the department because how you're funded matters. So I'll use tobacco because that's the most straightforward example. Our tobacco prevention specialist has a lot of expertise and knowledge around tobacco information. And often it would be a really perfect person to go up and share information, which absolutely can happen. But they cannot cross the line into lobbying at all because of how they're funded. So staff who are federally funded through grants are not allowed. It usually will say it right in the contracts that you receive from the federal government that those staff that are funded in that way cannot. So you have to be really careful with your staff. So I tend to be our department representative or our administrators tend to be our department representative during this legislative session. If there is a question that comes from one of our local legislators on a specific topic, I will engage with staff that have that expertise. And then of course, there's we can educate all day long. There's no limitations to how much we educate. So I encourage our staff to be the core educators. And then I take on the lobbying piece of the work.
That's a great point, Brenda. Thank you. Yeah, if you look at your task orders, with federal money, almost all of them say you can't use this money for lobbying. What that doesn't mean, and you don't want to use this as a workaround necessarily, but I've had tobacco prevention specialists, for instance, who are extremely passionate about one thing or another. And we've had the conversation, okay, if you are, as a mom, as a Montanan, you want to contact your legislator, go ahead and do that. Just don't do it on behalf of the health department. It doesn't take away their First Amendment right to be heard. It doesn't take away from their ability. Remember that exemption for somebody acting on their own behalf. They just shouldn't be doing it and saying that they represent an organization unless you're really clear that they're being paid in a way that is allowable. And if it's federal money, it probably isn't allowable. Other questions, comments? Okay, I'm sure you're all relieved to know that this ends the time when you're going to have to listen to me hack my way through this presentation. I'm going to hand it off to Lisa. I appreciate your patience, and Lisa, take it away.
Thanks, Matt. I thought you did an excellent job, and imagine you're ready to go put your pajamas on. So, okay, I'm going to share my screen. Okay, and I'm going to have the same trouble as Matt. I think it's a Mac issue, where if you go into presentation mode, your screen goes black. So you're going to get this view of it. Hi, everyone. I'm Lisa Dworak, the Executive Director for Confluence Public Health Alliance. And if you're not familiar with our new alliance, just hold that thought. I'm going to share more momentarily, but want to extend a happy National Public Health Week to everyone. It's a really good reminder that we're connected to a strong field across the country. And so we can look to each other when those days get really long, and during the session when it feels like maybe we're out there on our own. So keep that in mind. And big thanks to Matt and Emily for creating this space for this training. And I want to give you all some kudos as well. Presumably your presence shows that you understand how important it is to be able to communicate with your elected officials, regardless of how confident or experienced or really where you're at and what challenges you face within your community or with your partners. And so just kudos to you all for being here. So I imagine what some of I'm going to share with you is probably redundant, but maybe in some ways it drives home some of the key points to this work. I wasn't able to join last week, but we'll continue to harp on the importance of relationships. So going to provide an overview of our public health nonprofit organizations and really the infrastructure that we have for these organizations to engage at the intersection of policy and politics. I'm going to talk about those levers for effective communication. So really, what is that mix to establishing, to reaching sort of our outcomes in working with our elected officials and protecting the health of our communities? And then what does this look like at the state level and the local level? So this will be redundant, but I'm going to ask all of you to clue into some of these actions, these examples. They really do come from your peers. So I've been in my position for 3 months and had to really lean on the experience and expertise of our boards and folks from across the state. So walking away today, I want everyone to understand that the public health policy and advocacy infrastructure that exists to support you. And I want everyone to commit to one lever strengthening action. So what's one thing you're going to do after this training, and what's a deadline that you're going to give it? So moving right along. Okay, so our 3 public health nonprofit organizations in Montana are the Montana Public Health Association, the Montana Environmental Health Association, the Association of Montana Public Health Officials. These organizations have been around for quite a while and have distinct memberships and really serve distinct purposes within our public health system. They have recently formed under a new strategic alliance called Confluence Public Health Alliance. And pre-pandemic, there was a recognized need across the state to really strengthen these public health organizations so they could work most effectively, and not only in policy and advocacy, but in their other areas as well. And so what was really neat is that this was identified before the pandemic, and now coming out of the pandemic, it gives us a really unique opportunity to engage with each other just more strongly. I think one thing that's, apologize, my dog is all of a sudden very active in my house. So, so these organizations are 501c3s, and ANFO is a 501c6. And so what that does is gives us quite a bit of flexibility in being able to do advocacy work, you know, going up to toe that line with lobbying. And in many circumstances, it gives us even the ability to lobby and extend some of that flexibility to the our local partners. Please do remember that, though, these organizations do not just do advocacy work. They have other priorities as well. And this is a great time to re-engage with these organizations. And you're going to learn a lot more about these next week at the conference. But like much of public health, they face some really significant challenges the past couple of years. And this is a great time to tune in as they rebuild and reignite with membership across the state. And the last thing I'll share is that these three organizations are now supported by centralized staff. So that's a key part of this alliance, is they're their own organizations with their own missions and their own boards, but have one centralized staff that's supporting them. And the value that this adds to all of you in the public health system is now myself, and we're in the process of hiring, really are clued in to what is happening, you know, what's affecting our lead local health officials, our environmental health professionals, our public health nurses. And so really bringing all of that together and coalescing it within these different committee structures and different partners, like with the Institute and stuff. And so there'll be a lot of value that comes from it. So these organizations have some really specific structures in place to do their policy and advocacy work well. And chiefly, we have our Joint Policy and Advocacy Committee. And so this committee has representation from each organization and really serves to work at the intersection of policy and politics. And so that's a pretty lonely intersection typically when you think about, you know, it feels pretty safe to engage in policy and think about policy and promote policy, but we live in a hyper political climate now. It's just the reality. And there's a way to do it that's non-polarizing, but we have to figure out that space at that intersection and how to be really strategic. This committee also monitors what happens during the legislative interim. So with our ARPA committees and our interim committees, a lot of important work happens during the even years. And that's pretty unique to Montana. And so that's a challenge that we experience even working with national partners. They just don't really understand what, you know, our off year looks like. They work to support lead local health officials. I think a good example on this committee is that a lot of the committee members are local health department employees that have been able to figure out how to work fluently between their local health department role and engaging in this state level committee. And so they do a lot of advocacy and they contract with a lobbyist. And so that lobbyist is doing all those pieces that Matt said, you know, we have to be very mindful of. And so through this committee structure, we're able to really go up to the line of lobbying and then hand over a lot of that to our contracted lobbyist. What is perhaps exciting or scary is that Montana has been identified by national organizations, not just our national affiliates in the American Public Health Association and NACCHO, but others I'll talk about later, as being a state that is going to have some really heightened challenges during the legislative session. And so we have a lot of attention right now. We have some funding opportunities, all very exciting. So this policy committee, that's a lot of those opportunities as well. And then we're not alone. We have a really great public health network. And so Some of our key partner organizations include the American Heart Association, the Montana Medical Association, the American Cancer Society, and the Montana Hospital Association. And there's coalitions that those organizations lead that we also are a part of. And then we're looking to really expand our networks. And so if anything over the past 2 years, we learned is that we need people outside of public health to advocate for public health. And so really looking to our partners in healthcare, education, and government. The Montana League of Cities and Towns is really committed to protecting local governments and local government's ability to be responsive, and is really stepping up as a public health partner. And so there's some exciting new partnerships coming out of some of the decisions that were made last session. So that's just kind of an overview of the infrastructure that's happening at the state level to really support you. Okay. So I imagine, we have a smaller group than I anticipated, which is excellent, but would like everyone to just throw in the chat, what is your role in the public health system? Are you at the local level, the state, tribal level, non-governmental? What's your job essentially? Okay, lead local, state trauma system manager, BEP, local public health director, environmental health program specialist, public health director, local, awesome. Staff, tobacco use prevention program. Okay, we got the whole gamut. Okay, and then the next one I have, we actually have a poll for County Communications Coordinator. Hi, Pat. Nice to have you on here. I'm jotting you down as like, oh, County Communications Coordinator. We should reach out to more of those. So glad you're here. Okay, so a gut check. Wanting to just assess where people are in their comfort, experience, and willingness to act at the local level. And so Emily does have a poll. Emily, I'm not sure how polls work. So
yep, I will launch this first one and it should pop up for everybody.
Okay. So the question is, where are you in your comfort, experience, and willingness to act? Local level. 1, I'm interested in building confidence or experience, not ready to act. 2, I have some confidence or experience. I'm hesitant to act. Acting is really hard. 3, I'm confident. I'm experienced. I'm acting. I'm eager. Which one feels most closely aligned? Okay, I think I have a pretty good selection. Take a screenshot of that. I think what's interesting is that it's in some ways pretty evenly split across the 3 buckets. And so it shows that, we're just all at different places, but can get something out of all of this. And I think for those 3s out there, we're really relying on you to share your experience and expertise. And so please do chime in. And for the 2s, really look to those 3s. So I think AMFO and some of those our other public health partner organizations can really serve as a way to connect with those peers that are operating pretty savvily in this space. And for those 1s, I always go back to, what's that sort of magic number for moving from like uncomfortable to like an excited type of uncomfortable. And if we can get you like a 4% growth from uncomfortable to excitement, that's the direction we want to head. Okay, so the next question is the exact same question, but at the state level. Okay, so again, a pretty good smattering across the board. Definitely have more 1s on this one. If anyone's willing to share, I'd be curious, why maybe you feel more comfortable at the local level than the state level. You can pop it in the chat or unmute. Putting people on the spot, don't feel like you have to.
Hey, this is Amy. Figured talking would be easier than typing. I accidentally put 1 for both. I jumped the gun. I'm very comfortable at the local level. But as far as the state level goes, I think that it's a reflection of my understanding, of how the systems are put together and kind of what our role is and, with public health. So locally, I'm very comfortable, and that may just be because it's been quite a few years of communicating with our local government officials. But yeah, as far as the state goes, it feels very foreign to me. So that's one reason why I'm much more hesitant, at the larger level than I am in my little comfort zone here at home.
Thanks for sharing, Amy. That's really interesting. And I think what that speaks to is we can try and describe the process to you, or, but it sounds like really matching where public health is important in that process, more than maybe just the actual process. So Matt, feel free to jump in too if you have anything to add.
Will do. I mean, I think one thing to keep in mind is people are people. These are just, whether it's your county commission or members of CHI. I spent almost 10 years covering, as a newspaper reporter, covering Capitol Hill and the White House in Washington, DC. It's people. They're the same people. They're not really any smarter. They're not really any dumber. They're just people. And so making sure that you always remind yourself of that and not getting too intimidated by the rules and by the ceremony and by the procedure and by the egos. They're just people.
I noticed that Pat Zeller has their hand raised.
Oh,
Well, kind of maybe like Matt, I was a journalist for a very long time in Billings and an opinion editor for the Billings Gazette. And so I'm comfortable talking to all these officials. I think on the local level, at least in Yellowstone County, our local officials tend to stay in office for a very long time. And so you get to know them, you have those relationships, but the legislature does change over more often. And also they have that real short time frame to do the people's business. So I think it's a little harder to establish relationships with them, but definitely worthwhile. And I'll tell you the advice I've been giving to everybody that I work with and on our boards is, if you know anyone who is in the legislature or is running for the legislature, contact them now and say, hey, how are you doing? I am a resource. If you ever need any information, call me, text me. I want to help, because you're so right. It is crazy during the legislature, and establishing those relationships now and way before people go to Helena is critical.
thanks, Pat. And I think that goes back to, use each other as resources. There's definitely people on here, it sounds like, that have quite a bit of experience and feel pretty comfortable navigating those relationships. So the more we can help each other, it helps all of us. Okay, one last pulse check for you. Just curious out there what policy issues everyone is most likely to engage with elected officials on. I know it's going to matter who the person is, what the specifics are, but are there some issues you're 100% in on and others there's some dependence? The Public Health Authority, which has become in some ways preemption. The national level, that's how they're looking at it. Immunizations, tobacco, D is food safety, E is behavioral health, and F, the social drivers of health. So we have a lot of lead locals on here, and unsurprisingly, Public Health Authority got several. We had one for tobacco and several for behavioral health. And so behavioral health has come up as in a topic area that there is a lot of support from both political parties for. And so that's a great one to use as a conversation or a door opener when talking with people, because everyone has a personal connection to someone impacted by behavioral health. And those legislators do care about people in their community. And so those stories can have a lot of impact. Okay. So moving right along, thanks for the poll, Emily. There's no perfect, oh, go ahead.
Oh, I just said, no problem.
Thanks.
Hey, Lisa,
Yeah.
could we just drill down on that a little bit? I'm wondering, I think 3 years ago, nobody would have answered Public Health Authority, and there may have been more people talking about vaccines or one of those more specific issues. I'm just wondering, for those who answered Public Health Authority, why is that the issue that you're most comfortable with or most pressed on? Just those who provide that answer, I'm just curious to hear what your thoughts are on that.
That's a good question.
I'll just speak up and say I selected A, and it's because I don't think our fight is over with public health, protecting Public Health Authority. I haven't fully read, but saw the report that came out from the Network for Public Health Law yesterday that gives a summary of 50 state legislative bills that continue to chip away at public health authority. So I think the nightmare started in 2021, and I think it's going to continue, and we have to engage. We have to work on it, and we have to continue to protect to the best of our ability.
Thanks, Brenda.
Yeah, and Matt, if it's okay if I add, was forced to choose one response, but recognize that that's the one that I'm probably most well versed in. So there's comfort there. But also, like, I don't do the tobacco grant, so I probably wouldn't be as comfortable, talking about the importance of prevention there. But social drivers of health, I think it's really just a matter of like where we feel knowledgeable and where we can make a difference. So I don't know if anybody else relates with that, or if they were forced into learning authority like I was, but yeah.
Thanks, Amy.
Thanks, Matt, for digging deeper into that one. So in looking at, how do we actually communicate effectively, there are some levers, and some levers, can be stronger than others, and it's really a mix, and having some of each at play at the right time. And so I was talking with one of our most seasoned committee members, and, they really wanted to emphasize that, like, yes, there are levers for effective communication, those being relationships, communication tools, and timing, but really it's relationships for effective communication. And that is, Montana is a relationship-based political operation. And so Matt drilled this in, I'm sure the panel drilled it in, but those relationships are so important. And so I'll probably drill it in a little bit too. But it's a full cycle of establishing, building, leveraging when we need it, and then maintaining, thank you, and really, having a network, knowing who has sway with who, and doing a lot of, upstream work to have yourself be on the radar of folks within that network. And then the communication tools. So what is our single communication objective? Do we have good visuals prepared ahead of time? And then, as Matt said earlier, it really is a two-way. It should be a two-way communication stream with our elected officials. And then timing. So the window of opportunity is sometimes very short. And so when we're trying to do effective communication, there is the groundwork. And then, as Pat shared, the session happens, and sometimes those windows for communicating about a specific piece of legislation demand a pre-established relationship. And so that window of opportunity can be really, really short. And I think this is where, that joint policy and advocacy committee infrastructure that the Alliance and AMFO, MPHA, and MIHA provide is really critical, because they are serving as that political strategist brain and know how many votes we have for certain things, or what bills, might turn into a hot issue. And so how do we get ahead of that? And that's when we can tap into the first piece of the relationship. So there is no perfect recipe, and it depends a lot on the person and what's going on in your community. And then the other piece here is really looking at, that grassroots approach of advocacy. And so again, it goes back to those relationships, especially in a state like Montana with the citizen legislature and our decentralized public health with government. So really knowing how to overlay that grassroots piece with working the halls and the inside game is how we come together to really protect public health through policy at the state level. So I'm going to start with communicating with state electeds. And, I think we've gone over this already, and Pat basically gave a spiel for the slide. So thank you, Pat. But, don't be afraid to reach out. I mean, as Matt said too, people are people, everyone puts their pants on the same way. And it really does, boil down to how you can be a resource and making sure they know that you're willing to be a resource. Inviting them to come to the health department if you haven't done that, to take a tour. We have a really opportune time right now coming out of the pandemic to say, our health department's re-engaging in our core public health functions. Like, we want to share that with you. You know, the last 2 years we've been hyper-focused on COVID response. And so this is a great opportunity to reach out and re-engage. And then building those relationships. So once we have that established, really looking before the session, probably June to October, of saying, you know, these issues are important to us. My organization, AMFO, has this legislative agenda. Can you support these issues? Which ones can you support? What do you think of our legislative agenda? And really getting a clear sense about where your representatives are landing on specific issues. And so what that does is gives us a ton of information, lets us take stock. So when we know how many votes we need, we know sort of who has the ability to sway their representatives. And then leveraging. So this piece is important because they might tell you they're going to support, let's say, immunizations and daycares, and then they might be trading, you know, a vote for a vote in some other way. And so we got to hold them accountable too. And so if we know who's willing to, you know, be supportive of certain issues, we as the Joint Advocacy and Policy Committee can help track that, and then reach out to our local public health partners and say, you know, so-and-so from your community their vote keeps changing. Can you check in with them? And then it's always thanking them for their time. And so I've heard before that, you know, if a legislator votes on a certain issue and then never hear, let's say this issue is suicide prevention, and they vote in support of a suicide prevention grant, and then they never hear from their community about how that grant benefited their community, then they might be less likely to vote for it, to, you know, give that yes vote later on. So it's a full cycle of that relationship. And I think too, just quickly, this slide can really maybe help you pinpoint an action, especially between now and October. Like, what's one action in this relationship and trust building process that you can select to do with a state elected? You know, where are you at in this process? So another important part of communicating is that communication tool. And, you know, often it's finding common ground. And so it's going back to public health isn't just COVID. Last session, we were hyper-focused on COVID, and legislation passed that was a direct reaction to COVID that's going to have implications in other public health functions. And so we want to bring it back to some of our core public health areas. So I stole these visuals from Lewis and Clark's community health report. Thanks, Brenda, for sharing these. And I think they're really great visuals. We don't want to overwhelm state electeds with, you know, a 20-page document necessarily. We want to highlight the most critical points. And after we kind of know too what they're passionate about, we can match up some data that we have and match up to their interest areas. I think a big piece to remember is that to communicate that public health is a skilled, experienced, and credentialed workforce. And so we, you know, want to elevate just how seasoned our staff is and the credentials that they bring to this work. Okay. And yeah, I think Matt said it well. It's a two-way, you know, it's a two-way street. So figuring out what's important to them, having one take-home action or item to leave with them is really important. And then that timing piece. So I've talked about this, but the window of opportunity is really, really short when it comes to the session. And so we can't really build the airplane and fly at the same time. And so the relationships and information that we shared is that airplane that we built and established, and then we can hop in and fly it to the finish line during the session. And so this is where these organizations are really important because they spend a lot of bandwidth tracking legislation and working with their partners like Montana Medical Association, those coalitions, to know how things are happening behind the scenes before bills are discussed in committee or taken for a vote. We're working on a targeted list of legislators. So there are some legislators that are always going to vote with their party, but there's a good chunk of them in the middle, you know, whether you want to call them malleable or passionate about some public health topic that we can really create some inroads with. And so we're really looking at this targeted list and how we compare it with lead locals and staff, communications coordinators like yourselves to really match make legislators that might be friendly to certain public health issues and to our grassroots efforts that can really build those relationships. So I want to share just really quickly an example of this all coming together. And this example comes from the Montana Public Health Association. So several years ago, Laura Weir, the outgoing executive director, worked with a health officer or a lead local health official in the county to figure out where their representative was on raw milk. And so they met with them before the session around August and said, you know, here's our legislative agenda for Montana Public Health Association. Our health department supports this. You know, how do you feel about this? And the state rep said, and the representative said, you know, I can't support these, but yes, I agree on raw milk that, you know, I will, you know, support public health when it comes to raw milk. And so there was a bill on raw milk and it, you know, was getting moved through committee and through the House, and this person changed their vote. So they voted no in first reading, and then second reading, they voted yes. And so MPHA was tracking this, and they were able to reach out to that lead local health official and say, you know, so-and-so changed their vote, and this is going for third reading. Can you please reach out to them? And that lead local health official reached out to their representative and said, you know, we talked to you, and why did you change your vote? And they were able to change their vote back. And so I think that's a really good example of how the relationship was established and it was built early on. And then through this, through MPHA's policy and advocacy infrastructure, they were able to track this and ultimately get that vote that they needed to protect public health. So just a little example. Okay, and then I think this really does come back to the last 2 years taught us that we need people outside of public health to advocate for public health. And so this map shows that in our state over the past 2 years, 26 lead local health officials, there's turnover in 26 positions across the state. And so while yes, some did retire, many, you know, just couldn't stick around in the 10 challenges they were facing. And this was experienced across the state, and it's not just a lead local health official position. And so we need to really look at that network of, you know, do we have supportive physicians in our communities? Do we have supportive business owners? Who else is an ally for public health that we can build up their understanding and build up their support for us? And also, you know, Drenda did a great example of talking about how she uses her staff, but when we have 26 local health officials leave, you know, is our management or do our employees and staff really understand how decisions at the state level directly impact their programs? And so having them be savvy in their understanding can go a long ways as well. Okay, I shared a lot, and I'm wondering what thoughts, questions people have about interacting at the state level and how that connects to the infrastructure provided by our public health advocacy organizations.
Lisa, if you're not going to cover it later, can you talk about the difference between, if there's confusion about the difference between AMFO, MPHA, MIHA, and Confluence, and how those things interrelate to one another?
Yeah, like the core purpose of each.
Yeah.
Yeah, I can definitely talk about that. And I probably should have gone into more depth. So Montana Public Health Association exists to serve the public health professional workforce of Montana. And so anyone can be a member of MPHA, public health nurses, anyone in our public health department. And Montana Public Health Association is connected to a national organization called the American Public Health Association. American Public Health Association is very active in supporting their state chapter. The Montana Environmental Health Association was created by registered sanitarians to really serve the entire environmental health field, but their primary membership base is registered sanitarians. And so they are connected to also a national chapter called the National Environmental Health Association. And then AMFO is our Association of Montana Public Health Officials, who really does serve to support our lead local health officials. And that membership is in some ways exclusive, but that lead local health official also represents, the interests of their employees and their staff through AMFO. And so each of these organizations have a distinct membership. Each of them really do have distinct policy interests, but a lot of overlap. And so as you can imagine, AMFO would be primarily concerned about public health authority, but really any public health issue that is going to impact their staff's funding and programs. And then Montana Environmental Health Association is really focused on food safety or, septic and variances in zoning. And so I think often our registered sanitarians and the work that they do is sort of put off into other committees or into other spheres. And so this alliance structure is really unique in that we're connecting many of the important issues in the environmental health field directly to our lead local health officials in AMFO. And Montana Public Health Association has been primarily concerned with similar issues as AMFO, a lot of it to access to healthcare and public health services in our rural communities. And so these three organizations provide a number of programs and functions distinct to their members' needs, but also to really support the public health system as those nonprofit organizations. And so they've also experienced all the same challenges. And so while our Joint Policy and Advocacy Committee has typically been very strong because we recognize how important that is, and our three organizations have collaborated well in that sphere. We have had some missed opportunities in other areas of our work. And so this alliance structure is really to ensure that we're working together and aligning in all areas that are impacting our members. What else, Matt?
Well, I don't want to step on anything you're going to talk about later. I think in the past, MPHA, MIHA, AMFO had functioned separately, but coordinated very closely during the legislative session to the point of having a shared lobbyist, weekly calls. I don't think any of that, and Brenda and Lisa, you can correct me if I'm wrong. I don't think any of that changes, but what we also have is this Confluence Public Health Alliance as an umbrella over all those organizations, hopefully bringing more administrative capacity, leadership capacity to that work. And this will be the first legislative session where we have that structure. Is that right? Yeah. So this will be the first time. The big point for all of you is that those organizations, Confluence, the umbrella over MPHA, AMFO, and MIHA, really provide a way for public health professionals all over the state to plug into the legislative process. You don't have to. It really brings the learning curve down. You'll be connected to people who have may have much more experience than you have, and can answer some of those questions, as well as hopefully a professional lobbyist who has much more experience than any of us understanding the intricacies of how the legislature works. So my point is that those organizations separately and together really provide a great way for individual lead health officials or public health staff who work with lead health officials to plug into the process, become engaged, and work together and collaboratively, rather than feeling like you're out there doing it all by yourself.
Definitely. Yeah, I'll talk about that a little bit in a couple of slides, but I think that is a key point to take away. And also, to recognize that our alliance is brand new, really 3 months off the ground. And we are recognizing how important it is to get our ducks in a row for this legislative session, because the last one was really hard. And I think there's no doubt that this next one is going to be just as hard. And so we're doing a lot of prep work right now, in addition to figuring out how our three organizations work together. And so it'll be really exciting at this conference to hear from you all what's important what's important for these organizations to focus on, and what's important for our Joint Policy and Advocacy Committee to focus on at this next session. So my next couple slides are just really quickly on local electeds. And again, the recipe is pretty similar. So relationship, communication, and timing. You know, and surveying our AMFO board. So the AMFO board is made up of lead local health officials, and they are recruiting for board members. So if you're interested, it's a great opportunity to get involved. But have representation from big, medium, and small, and really emphasize that, you know, when it comes to county commissioners and even county attorneys, there should be no surprises. And sometimes, you know, we need to really emphasize these neutral topics like septics and variances to establish a good working relationship before we get into topics that were more contentious. And it's what is the routine communication, what works for them and what works for you. You know, we don't want to overwhelm our county commissioners or county attorneys, but we also do need their support and to have their input from the get-go, especially that county attorney. And really do want to drill in that it's an opportune time post-pandemic. So it's a great time to re-engage, should check in, and, you know, elevate the needs of our community beyond COVID right now. Okay. And then with county commissioners, you know, you might have a good relationship with all of them, you might have a good relationship with none of them, but if you can find a good relationship with one of them, really use that one to create inroads with the rest of your county commissioners. And so again, there aren't many surprises, and one can really speak to good public health practice. Sounds like at the last training session, there was some discussion about county attorneys or some questions about the county attorney relationship. And so I've never been a lead local, I've never been an attorney. And so again, went back to the AMFO board and said, how do you work with your county attorney? And they emphasize a lot of the same things. You know, we really have to put in the groundwork and build that relationship. And it's just going to take time and persistence. And you got to really respect their time. And so being really strategic with communications. And this is where I think AMFO, and I'll share this in a moment, in the next slide, can be a resource. It can really connect you to each other on certain issues that, you know, how are you tackling your intergoverning body within your county? And how is your county attorney helping with that? And so we don't necessarily do a poll for this one, but recognizing that, you know, you might have a county attorney who's full-time or part-time, or a deputy county attorney that you're working with, and that will probably impact, you know, their ability to be more hands-on or not with your public health needs. Yeah, and then just always start with the county attorney. So that's the step one towards moving anything along the process. Does anyone, Brenda, Matt, anything to share on the relationship with the county attorney?
I would say the other thing that's important to know is, you know, Title 50 of the state statutes assign to the county attorney the duty to represent the Board of Health and the health officer. So it's not that you're asking them for a favor and do you a solid, you know, and you need to address it that way. Like, you all have a job. It's pretty clear what their job, part of their job is to represent you. Don't be rude about it. Don't be arrogant about it. Don't be, you know, and understand that they've got a lot going on, including, you know, criminals that need to be prosecuted and lawsuits that are probably being brought against the county. But they are your attorney, and they're assigned that in statute. So just to be clear, just to make sure you know that and understand that, that's part of state law.
Great. Any other thoughts on the county attorney relationship?
So Lisa, I think the always start with your county attorney in your slide may have come from my comment yesterday when we were talking. And just as an example of what that might look like is early on in the pandemic, we needed to develop those isolation and quarantine letters, or orders rather. And we knew that those needed to be enforced, be able to be enforced. And the enforcement mechanism had to be in place. Otherwise, it's just a piece of paper. So I worked both with the county attorney's office and law enforcement early on to make sure that all those parts and pieces were in place, so that when that isolation order was issued to an individual, that it wasn't just a piece of paper. And it really does, it has helped me and benefited me greatly to just start with the county attorney's office and say, this is what we need to accomplish, help us get there. And they always, at least my experience is that they, first of all, appreciate being on the proactive end of it. Otherwise, they feel like they're cleaning up a mess if I've gone down the road too far without them. And are typically will be much more helpful because I've asked them up front to, you know, share their expertise and to help us through a situation. So if that's helpful.
And I think what we saw last session, what keeps coming up is that some of the bills, you know, really demand the county attorneys to do some deep legal interpretation into, you know, interlocal agreements or public health authority. And, you know, there's been a lot of asks about the Montana County Attorneys Association, like because Montana is decentralized, it can just vary. Some of that interpretation can vary between counties. And so you know, how can public health use legal review or the judicial system to really provide some, you know, some light, like a clear path to some of these pieces. So it's going to be different just based on our governmental structure, but there, I think, is there now more than ever a need for public health to partner with our governmental associations, nonprofit associations like MACO and the County Attorneys Association. So those are relationships that we're trying to establish, recognizing that it will directly affect, you know, and improve the working relationships at the local level. But relationships take time. Okay. So again, just want to, you know, as Matt said, and on his closing remarks, like, you are not alone. You have a whole, you know, state of peers that are going through similar challenges. And so really what we're trying to do is connect the peers, connect you all in ways that are meaningful and provide value to your work. And so here's just a couple of opportunities that I wanted to highlight. The MPHA MIHA conference is next week. Hope to see many of you. There'll be some really great sessions, but hope that you can, you know, save some brain space to talk with each other between sessions and at luncheons and the socials. That connection time is really important. AMPO is having a public health appreciation luncheon. And so typically AMPO would invite all their members to lunch. But we recognize that, you know, we need to engage with all levels of management and staff. And so we really want everyone to come, but please RSVP if you're coming, so we have enough lunch. And you can RSVP directly to me, and your staff is welcome. There are great pre-conference sessions starting at 1, which will be another great opportunity to connect and conversation with each other. The Small County AMPO call has, at the request of several members, going to have a partner update once a month. So from the Institute and ourselves, other public health partners. And then the 2 weeks after that, we'll have a peer-to-peer support call. And so that'll be specifically lead local health officials from medium, small, and frontier. I believe medium's on that call. An opportunity to just talk to each other, talk to about county attorney relationships, talk to each other about intergoverning bodies, you know, whatever it is, that space will be for you to connect with one another. So Melissa Moyer and Jen McCauley on the AMPO board have graciously agreed to help facilitate that. And it'll be completely organic, but they'll make sure that there's things to talk about and fold people in. If you're not on those calls and would like to be, email Stephanie Tesaro, who is coordinating, wrangling us. Brenda says that Melissa and are hosting a conversation for new lead locals at 1:30 on Monday. So that's during the pre-conference. And then the other thing I want to drive home is this Connected Communities platform. It's been around for 2 years, but we just renewed the subscription for year 3. And ourselves, the Institute, and the System Improvement Office are really committed to driving traffic to it. It's a great tool. And so we're going to start using it. And we'll be using it for lots of policy and advocacy updates. It'll be a great way to connect post-conference as well. Okay. And then just sort of looking at the next 9 months. So again, Confluence Public Health Alliance, as this new strategic alliance to our 3 public health nonprofit organizations, is brand new. And I harp that to say, we are figuring out who we are as an organization right now, in the midst of needing to do a lot of policy and advocacy work. And so here's just sort of a rough timeline for things you can sort of look to us to be engaging with you on. So between now and June, so June are when the primaries happen for our state reps, we're going to be reaching out to a lot of you to see what kind of relationships you have established in your community. What do you feel comfortable talking to your representatives, or will you feel comfortable once we know who that might be? And then July through October, really looking to build that relationship. And so we have a grant through the American Public Health Association. Are probably going to hopefully use that grant to do a political readiness assessment. And so this type of assessment basically says, like, okay, in our counties, who has a relationship with who? What issues are our state electeds willing to engage on with public health? And so we know going into the session where those levers exist and which ones are stronger than others. We're developing that targeted list of key legislators, and we're doing some matchmaking between you and key legislators. We'll be reaching out to sort of see where you're comfortable again, and then really looking at targeted training. So, that grassroots piece really depends on skills and confidence and willingness on key staff and lead locals. And these three organizations are really pouring a lot of resources and interest into Montana right now. And, they're recognizing too that we're in a time in public health that we have to really engage up to that lobbying line. And so I think Matt did a great job of really establishing that line in some ways. And so can we engage up to that line, and when can we engage over that line? And so really feeling good about that going into this session will help us out as well. And then, yeah, that's all I have. So I just want to say thank you for listening and being gracious as our three organizations and the Alliance really do some rebuilding and get our feet underneath us for the next 9 to 12 months. So any questions or discussion, things you want to share with the group?
Thank you, Lisa. Really appreciate you being here. This is really, we didn't really plan it this way. It's really fortuitous that we're doing this session leading right up into MPHA next week. I think everyone's excited to see each other. Are there questions out there for Lisa or I or Brenda or anybody else that's on the call? Okay, Stephanie Harrington says not yet. I think that was in relation to my question, and that's thank you, Stephanie. I mean, I think one thing that I want to stress is that you're not alone in this. The associations that Lisa just got done telling you about are there to help. The individuals that you see here and many others are here, always available to answer questions. And the one thing I would urge you, public health has gone through a pretty hellacious couple of years. It's been hard on everybody. I think the one thing that you can do is just show them who you are, show them your real face, show them that you're Lorene Murphy from Dawson County is somebody who works hard every day on behalf of the people in Dawson County. Because I think public health, if we don't do that, if we don't show them that we're real people just trying to serve our communities, that leaves the opportunity for that gap to be filled by some other idea. And so if you do nothing else, reach out to those policymakers, make sure they know who you are, make sure they know the work that you're doing, and then engage with those public health associations so that we can represent ourselves during the next legislative session. And if you have any questions about engaging the legislature or engaging your locals, you can always feel free to get hold of me at the Institute, get hold of Lisa at Confluence, or get hold of your peers and your partners in other health departments. We don't have anything else. My voice is about to give way, so we're gonna give you 24 minutes of your day back. But we really appreciate
and I'll just add that I think we all recognize that the public health system is evolving, has evolved quite a bit recently, and so we're figuring out a lot of how we're going to work together and work together on these issues right now too. But I do know that all of us are happy to connect you to whoever you need to be connected to. And so just get connected and we'll get you to the right answer to the right people.
Thank you so much, Lisa and Matt. That was fantastic. Always excited to work with you two. And thank you, Drenda, for all of your input and for everyone else being engaged. I put an evaluation survey link into the chat. So if everyone could take a moment and fill that out, I know how much we love them, but it's a very short one. And it certainly helps us to, know what works, what doesn't, that we can keep offering high quality trainings. So if you can take a moment and fill out that survey, it would be appreciated. And just to thank you again for being with us for 2 sessions. And thank you for your expertise, Matt and Lisa. And I'm excited to see so many of you next week at the conference.